Well, now that the World Health Organization has declared COVID-19 a pandemic, concern has shifted to what this means for Canadian healthcare workers and for hospitals and for your care, especially after the outbreak of SARS led to cancelled surgeries in 2003. Joining us this morning is Professor of Public Health Services at the University of Toronto, Alison Thompson. Good to have you with us this morning.
Thank you.
We know that Canada has a pandemic plan. What kinds of changes can we expect to see now that this declaration is in place?
So I think it means that we're just going to carry on carrying on. To a large extent, it might mean redeployment within public health from some people who are not directly involved in infection control measures. We'll see more people put on that. But generally speaking, we've been preparing for this for several months now. So I think that we're well along the way. It doesn't mean a huge change in terms of the planning and response. We may see that the plan is now moving more towards containment and mitigation. So, I think we're beyond just focusing on containment, and we're now into management as well.
What about manpower at clinics and at hospitals? Healthcare workers that I've spoken to are warning hospitals, emergency rooms, clinics are already running at capacity. You put a pandemic on top of that and a separate stream of care. What kind of impact could that have? Do we have enough people to fill the plan?
So I think what we're going to see is a lot of surge capacity being built up, and the introduction of some assessment centers in particular that takes the pressure off some of the emergency room visits that we're seeing spikes in across the country with people who are not necessarily ill, but they're worried. And so those assessment centers will be popping up and staffed. It's certainly going to put a strain on the healthcare system, which is why it's really important that the public comply with the measures that public health is encouraging people to take at this point in time to keep that capacity in place.
But again, back to the subject of manpower, do we have enough people to be able to facilitate a separate screening clinic as well as keep our emergency rooms running?
Yeah, and that's where that redeployment comes in. And so I think we will be okay with regards to that. That's been the plan all along, and we're well prepared for that. I think what we need to watch for is making sure that those healthcare workers are well supported, because we know that burnout is a big risk here. It's a very stressful situation for them. They are at increased risk for contracting the virus because they are on the front lines. And so making sure that the institutions that they work for can also, provide them with the protective equipment that they need, as well as, other supports.
Yeah, the health of our healthcare workers was a big lesson that we learned from SARS back in 2003. We have improved our capacity to deal with these kinds of situations, like an outbreak, and a lot of that came from our dealing with SARS. You have expressed concern about the funding cuts to the healthcare system since then. What could they mean about our ability to respond, and does the money promised by the federal government help?
I think it's certainly Trudeau has promised that the money will be there if we need it. In Ontario, for example, the Ford government has cut public health significantly, and so that is a concern. A lot of those cuts weren't due to take place until next year, but we are already seeing the impact of that in Ontario. So I think this will be a wake-up call for provinces that we're thinking about scaling back on public health, that's never a good idea.
Alison, really quickly while I have you, what are you watching for? What's an area of concern for you as we move ahead?
I think that what we need to do, in terms of our own responsibilities, because the healthcare system is one thing, but what we can do is help take the burden off that system by doing things like getting the flu shot. If we can take the flu visits out of the system by getting vaccinated, preventing that illness in the first place, that will help remove that pressure from the healthcare system, which is quite significant. So anything that you can do to keep yourself well and prevent things like the pneumonia vaccine that's available for the elderly is also going to help with that regard as well.
Alison, thanks so much. Good advice. Keep yourself healthy from everything, not just COVID-19. Thanks for joining us this morning.
Thanks.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.